Welcome everyone to the How Healthcare Organizations Are Innovating in the Digital Age with APIs. That's a mouthful, but it's a very interesting topic. We're very excited to spend 30 minutes with you. We're going to do some quick introductions. We're going to go over a little bit of background. Victor's going to tell us a little bit about what's going on at UCSF, very specific to this topic. And then we're hoping to have some really good Q&A with you, the audience. So tee up your questions, your comments on the chat there, or we could even, I think, have people come on camera, but we'll make sure to confirm that. My name is Jason Rothbart. I'm the Area Vice President for HLS Payer and Provider at MuleSoft, and I will be the moderator today. Victor?
Yeah, hi, I'm Victor Galvez. I'm the Associate Director of Integrations at UCSF.
And Farhan?
Hi, everyone. Farhan Mojdehi, Principal Client Solutions Engineer for Healthcare and Life Sciences at MuleSoft. Thank
you. So, MuleSoft, if any of you don't know, is an API lifecycle and integration platform. We work with customers across all industries, but in particular, we've had a lot of activity and success in healthcare. This is obviously a very hot topic, given that we're in the middle of a pandemic, and a lot of the providers and payers and life sciences customers that we serve are having to innovate very quickly. They're dealing with regulatory challenges around, HIPAA and interoperability. You've got this massive national vaccine effort where the consumers are trying to connect with the providers are trying to connect with the state governments. And so that provides a lot of API challenges and opportunities as well. And then ultimately within the providers themselves, we're talking to a lot of customers about how do we enable a digital front door or create a better member or patient experience for our customers. Most providers have the electronic medical record and other tools, but how do you bring them all together to create an experience like we're used to with an Amazon or an Uber? And those are the kinds of things that MuleSoft can actually help do. So with that, I'm going to turn it over to Farhan to give a quick overview of kind of what this API landscape and offering looks like. And then we'll move on to Victor to talk specifically about what's going on at UCSF.
I appreciate that, Jason. So absolutely, healthcare is in this modernization phase. I think with COVID, it's really accelerated. Also with the new CMS mandates, it's impacting payers, providers, but other folks in the healthcare and life sciences arena. And as this proliferation of APIs starts to happen, we're starting to see this trend of being able to move quickly to meet these new use cases, these new initiatives. And with any project, around 80% of any project, that time is spent integrating. So if you have a way to move quickly, be more agile, and by agility, we mean business agility. If you have a way to be more business agile, you have a platform behind you that can do that. It really allows you to leapfrog your competition. And this is what UCSF has done. We just have a snapshot of a zoomed in view of how they're using the capabilities around APIs to allow their developers to innovate faster and meet those use cases much quicker. And Victor will go into more detail, but at the bottom level here, we're connecting to these back-end systems of record, whether they're clinical or whether they're non-clinical. They could even be third parties. So as you see there, the snapshot we have is just connecting to Epic, but the other use cases also involve non-clinical integration as well. As they connect to these systems of record, they abstract that complexity of connecting through an API, whether those back-end systems are API enabled or not. So this is very powerful in healthcare, right? With FHIR coming up, not only are you API enabling these back-end systems, but you could also be FHIR enabling. And that's what we've done here at UCSF. We FHIR enabled the back-end clinical EHR to be able to meet the business processes that you can see at the process layer, right? Being able to discover and reuse those as assets in a more composable architecture. If you think about it, very building block oriented, right? So taking these building blocks, putting them together, and then sometimes the integration ends there. You're able to integrate these systems together. But if you need to provide new experiences on top of that, you can easily do that with our 3-tiered approach that you see here. And I'll turn it over to Victor to double click a little bit more into how he's met some of these initiatives at UCSF with this API-led architecture.
Thank you so much, Farhan. As you may know, UCSF is a company that comprises of healthcare, research, and a school for life sciences. And our team, the integration services team, supports the real-time integrations at UCSF. And we've had MuleSoft as our long-standing partner in our integration journey towards modernizing our integration capabilities starting more than 9 years ago. At UCSF, we accelerated the adoption of healthcare APIs and FHIR to support the more modern integration with the advent of meaningful use about 5 or 6 years ago. With meaningful use, we started to implement Epic APIs. At UCSF, we use Epic as our EHR. So with meaningful use, we started to implement the Epic APIs and FHIR resources. And MuleSoft was central to this approach. We use MuleSoft as our API manager to proxy the APIs for discovery, as Farhad mentioned. And we use it as an ESB to orchestrate and transform integration messages. In the beginning of that journey, our pilot for healthcare was with Apple Health. And after that pilot, with all the FHIR resources and Epic APIs behind MuleSoft, we were able to tackle projects quicker, with the reuse of the FHIR resources and APIs. I have to say, though, that with our experience at UCSF, we are finding that there's often need for a hybrid approach. In addition to FHIR, we use other Epic-created APIs. Sometimes we create custom APIs, and in some cases, we still use a traditional HL7 version 2. But regardless the type of message, MuleSoft was able to assist us in terms of integrating all the different types of formats. One example that I'd like to highlight is the Luma Health that we're showing here. As one of the pain points that we have at UCSF and perhaps in many other organizations is the absence of automated processes for patient referrals and patient self-scheduling. With Luma, patient communication was created to collect missing information when referrals comes in. Our referral reps would review patient information and then contact patients for missing information such as insurance cards, next of kin, and other demographic information. And they use this orchestration and these tools to collect all this missing information from patients. And after all this required data is collected, the patients are then contacted again so that they could self-schedule. As you would imagine, all of these requires many types of integration. That includes patients, insurance, physician profiles, schedules, and many others. And it includes many types of formats. That includes HL7 version 2, APIs, and FHIR. And with this solution, we use MuleSoft to perform all the connection, orchestration, and transformation of the interface messages. And this project was one great example of a collaborative project that has a high impact on patient satisfaction. As Farhan mentioned, we were able to provide a modern solution that our patients are familiar with. Our patients are ever-changing, have patient demographic, and we were able to provide them with the tools that they expect. This implementation also won an Innovations Award at UCSF as it tackled the pressing need to support that patients. So we continue to tackle many digital transformations at UCSF. And we've created a roadmap of projects to take on and improve our digital patient experience. And moving forward, we plan to have MuleSoft to be central to our integration solution.
Okay, thanks, Victor. I have a couple of questions for you, and to the audience, this session is for you. We wanted to keep kind of us talking at you to a minimum, and we're hoping to have a dialogue. So please enter your questions into the room chat or the Q&A, and we'll address them. And so I'll get Victor and Farhan started with a couple. My first question would be, what are some of the API type non-clinical projects that you're starting to see? What do the requests look like? What do the systems look like that are starting to emerge that you haven't seen in the past?
Oh yeah, thanks for that. So other non-clinical projects that we use for, as I mentioned, UCSF is also a school for life sciences. So we use MuleSoft to integrate student information, professor information, and grades and things of that nature. We actually just went through an implementation for cross-campus enrollment where other UCs are able to enroll in other UC campuses. And for that, we use MuleSoft as our integration solution when we integrate the different student information from the different campuses. In addition to that, we have many back-end applications as well, applications such as PeopleSoft. We use it to integrate staff information. So things like when people leave the organization, there's a automation that their access are removed from many systems. So when the staff change roles or when they leave, that the integration to the different applications to remove their access are then automated. The other examples, we use it for location services, for building information, so that we could marry staff information with locations. Yep.
Cool. Farhan, have you seen any other examples kind of across the customer base or the teams you're working with that you would want to call out?
Yeah, absolutely. Like vaccine management, lab reporting, I think has been highly touted this last year. I think folks have been doing it for a while, but having a more modern way to do vaccine management solutions and integrations with lab systems and with state reporting, that's come to the forefront, especially this last year. So that's one more clinical use case. I think for non-clinical integration, things like supply chain management, integrating with the supply chain, having more of that real-time data appear and be available, integrating that with the clinical systems like the EHR, providing that seamless transition from EHR to the ERP. I've seen a lot of use cases there as well. So, yeah, I think that kind of bodes a great question for Victor. Victor, what's next on your digital transformation journey with using MuleSoft? What are some of the other initiatives you guys are looking to meet and deliver in the next year or two?
Yeah, Farhan. So yeah, a lot, like you mentioned earlier, our patient population are expecting the same services or the same apps that they use for other things, such as, when they order car services or make reservations at restaurants and things of that nature. So more and more of that as expected. So we're going through prioritization in terms of what those are. So, continuing on with automating referrals. There's still a lot of things that are done manually. Automating self-scheduling, empowering the patients to, and providing information to patients to see who the providers are, what their specialties, location and schedules, general profile information, and then have the ability to create schedules, to do self-scheduling. Even items such as payments for the services. Um, Currently, all of those are the more traditional way of making payments. So all of that in terms of integrating information from one system to the other needs to be modernized. And we're making use of APIs and if possible, reusing the file resources that are already available. The biggest uh, power for that, obviously, is that it's modular and it should be consistent among all the different organizations. So as more and more organizations leverages file resources and these APIs, the better we'll be in terms of providing information to patients. Another project that we're going through right now is supporting Cures Act. And Cures Act is all about expanding the clinical information that's available to patients. So yes, all these clinical information are available to patients now. But with the Cures Act, the government is making it mandatory of a particular set that we need to expose. So we're going live with this in a couple weeks at UCSF. I know other organizations might have gone live with them already. But we also use MuleSoft to proxy all the FHIR APIs for the use for our patients.
So real quickly, I just want to urge the audience, please hit us up with some questions. We have a bunch, but we want to make sure we answer your questions. So we know that we're hitting the mark, or give us some feedback. Let us know if this conversation is what you want to hear, or if there was something else you want us to delve into. Sorry, Farhan, were you going to say something?
I was just going to add, I think it's a great point that Victor brought up, that consumers, patients, members expect connected experiences, but they also expect easy experiences, right? Mm-hmm. And it's funny you brought up the digital payment. I got a bill in the mail yesterday to pay a physician, and I actually had to call him up and take time out of my day. It wasn't very convenient, so that's going to sway me for my next visit. If I like physicians that make my life easier, right? I think we're all driven towards services that make our lives easier, and I don't think healthcare is any different.
That's right.
Yeah, I had to pay a lab, and I have one of those debit cards for your health savings account, and they didn't take that kind of card. I was like, what? How's that a thing? But apparently it is.
Yeah.
Victor,
in general, yeah. Go ahead.
Go ahead, sorry.
Oh, I was just going to say that, in the past, healthcare has been behind in some of this technology and adoption, but obviously we're realizing to be more competitive, we need to offer up the same types of services that people expect.
So Victor, part of, there's a technical element of this, but there's also a cultural element of adopting APIs writ large across an enterprise, right? You've got developers who prefer other platforms or technologies and legacy. How do you manage, or can you talk about how that evolution has occurred within your IT organization to urge people to adopt APIs more aggressively and to try to move in that direction? And how has the developer response been, and how are you able to kind of facilitate that?
Yep, absolutely. So the traditional way for integration, from many years ago, is through HL7 version 2. And that's what a lot of the legacy type of programmers are very familiar with. But with more modern developers and with more modern applications, it's not possible to use HL7 version 2, or it will be very kludgy. So we needed to make sure that all these APIs, specifically the file resources, are available to our developers that are, make sure that they're easy to discover and also a place where they could facilitate testing and development. So trying to make it easier for our developers is one of the challenges. as we had to make some investment to make sure that all these APIs and file resources are working appropriately. And then, going through a show and tell within our organization to make sure that folks understand that these kinds of integration are available, that these kinds of technology are available for their use. Important thing as well is making sure that we start small, right? A lot of these earlier projects that we've developed and worked with are using one or two types of integration. And as we became more familiar with them, we have various groups now within UCSF that are developing quite complex applications and using complex integration to provide these solutions. So start small, making sure, and then making the investment to make sure that you have the right resources to support the integration, and then going through some sort of marketing within your organization to let them know what's available.
Farhan, I mean, related to this topic, I know that we often, when we're working with customers, we have a concept called Center for Enablement. Can you talk about what that is and why that's important to help customers sort of scale and do more digital innovation, leveraging APIs?
Yeah, absolutely. I think, as Victor mentioned, I think he hit the nail on the head. We're very comfortable with HL7v2, especially in the provider space, to be able to do that integration. It's comfortable. It's like that warm blanket, but that blanket is kind of all raggedy, right? It's not the best way. It can keep you warm. It can get the job done, but it's not the easiest, I would say. Spending over 15 years in HL7v2 integration, I understand that it's easy to do, and for the most part, but the testing takes a long time, and you have to go through various scenarios to make sure that you're staying within the right parameters. Otherwise, interfaces can break. So APIs, at least with both FHIR or with proprietary APIs, can definitely allow you to take that design first approach. But it also, like you mentioned, Jason, increases the adoption of that, right? So a Center for Enablement allows for organizations to create best practices around the adoption of APIs. And curious, Victor, what do you guys do at UCSF for this Center for Enablement to empower internal developers, external developers, adopt an API approach first to integration rather than more legacy ways to integrate?
Yeah, so we've gone through in partnership with other UCs. We've put together some hackathons, for example. We're working with others working with other developers within UC to come up with like use cases in terms of what they could use the APIs. And then additionally, we've formed a governance committee, which is tasked to make sure that we go about the prioritization and approval for the projects that are wanting to use these APIs.
Yeah, that's a great point. I mean, it's one thing to have the data easily available with an API, but you definitely have to have the proper security and governance. So, folks that you want to access it can access it, and definitely folks that don't have that capability shouldn't be accessing it. So, great point.
Yeah. Both Victor and Farhan, do you see the use of APIs today and into the future contributing to your ability to govern data and monitor security to make sure that you're building compliant and secure apps? Could you comment on that?
I'm sorry, say that again, Jason.
I was just curious if the use of the APIs, this new culture, this new platform you're using, does it provide any benefits around governing data and monitoring security and scaling, things like that? Are there any best practices or ahas you've seen as you've utilized this platform?
Absolutely. So yeah, absolutely. We're seeing the actual usage of the data. So we go through when we go through development and we have applications starting using them. We make sure that we monitor their usage. Also understanding where they would be coming from. Um, um, the location of the application is quite important as well. So yeah, going through the API processes, improves the way we look how people use data, and a way as well to make sure that it's more secure.
Farhan, anything you've seen out there working with customers on this topic?
Yeah, I think it's first and foremost security and governance, but as far as who's consuming the API, what kind of client applications. With APIs, you're exposing things a little bit more broadly because it's a more loosely coupled architecture, right? So you definitely need that security and governance, but also the analytics to understand how your API is performing, how it's being utilized, how it can perform better. And as we go to this API as a product mentality, you want to decommission products or APIs that aren't performing well. You need the analytics, you need the security and governance around that to be able to iterate over those APIs to make them even more consumable.
Yeah, so at UCSF, Epic has been providing some analytics tools in terms of the consumption of the APIs. So we can see trending and who's using the APIs and such. But internally, we've started analyzing those trends as well to make sure that we're accounting for the need and who's actually using the APIs.
So we've just got a couple of minutes left. Victor, any sort of parting words of wisdom or advice for people that are either considering to, go down this digital API journey, best practices, lessons learned, ahas that you want to share?
Yeah, absolutely. Making an investment on the right team is first and foremost making sure that you have a team that understands not just the technology, but healthcare workflows. And then secondly, making sure that you have the governance to take on requests and making sure that the applications that will be connecting to the EHR or other systems has the right components, such as security. Because once you implement and expose all these APIs and FHIR, the request for consumption and the request for connection will greatly increase. So if you have the governance set up ahead of time, that'll be the best for the organization. So yeah,
Perfect.
so a good investment on the team and a good investment on the process would benefit a lot.
People, process, and technology. We hear it over and over again.
Yeah, it's not just one thing, right?
Yeah.
I think that's it. Thank you all for attending this session. Hopefully you got something valuable out of it. Please give us any feedback you have, and we're all available to answer follow-up questions. So with that, thank you very much and enjoy the rest of the conference.
Thanks, everyone.
Thank you.